My next guest today is Dr. Kathy Suber. She's a chiropractor and owner of Advanced Health of Naperville. Welcome.
Thank you.
So I'm excited to talk about your business because I know that you have been really a staple in Naperville for a number of years. So tell our audience a little bit about Advanced Health of Naperville.
Sure. I've been in practice for 16 years here, and we're right across the street from the post office, and we offer chiropractic, physical therapy, and massage therapy.
Wonderful. And you've been in practice 10 years?
I've been in practice 17 years,
17.
actually.
So you've seen a lot of changes, right?
Yes. We've had to navigate quite a few of them recently.
So we know in Naperville, there's other chiropractors. So what do you do, Dr. Suber, that really separates you from the other chiropractors in town?
Sure. I think there's different ways to practice. My way of practicing is we're going to meet you where you're at. So some people come in, they've thrown their back out, and they really want to just have a couple of visits and call me in 3 years when they may do the same thing. Yeah. Some people really want to take control of their health and make some significant changes, and we can sit down, go over all of that patient's goals, and create a full-blown treatment plan to get them to those goals and keep having them take steps towards those goals. So I think one of the things that makes us a little bit different is that we actually give you the choice as opposed to trying to make a patient fit into our model of what we think is best for you. And I think that is patients appreciate that.
Yeah.
Another thing is we really stay on top of the insurance changes and what your insurance will cover. As you can imagine, with what you face personally or for your business with all the insurance changes, we deal with that with every single patient that walks in the door. So it's been some challenging waters to navigate, and my office manager, Allison, and myself, we try to really stay on top of things so that no one ever is going to get a bill they don't expect, that we know what the changes are. And again, I think it's just that one level higher of customer service of people saying, oh man, that's so nice, thank you so much, because I don't understand it. Right. We can almost not understand it sometimes. And lastly, I've added a new type of adjustment to what I do at the practice, and it's called a cranial adjustment. Kind of long story short, my son Nick was born, and he was completely healthy. He nursed fine, and when I stopped nursing, I transitioned him to a bottle and formula, and he wouldn't eat any food. He just absolutely wouldn't put anything in his mouth. Baby food, purees, rice cereals, and he was fine. He was healthy, and he was 1 and he didn't eat, and he was 2 and he didn't eat, and he was 3, he was 4, and 4.5 years old, he was still drinking formula out of a bottle as his only nutrition. Wow. And one of my friend's dads is a chiropractor in England and specializes in sensory issues in pediatrics, and he had come to the United States to teach, and they drove to come see Nick and did this 30-second cranial adjustment that's done in the upper palate of the mouth. And the next day, I took Nick to feeding therapy, which he'd been in for about 2.5 years, and they called me crying, saying that he didn't stop eating, that he was eating everything.
Oh, my goodness.
And so I have, over the past couple of years, trained with this doctor, Dr. Jonathan Howitt, to learn the cranial adjustments and have implemented it now in the practice. And I've been just amazed at the things that it will unlock. A chiropractor adjusts mostly the spinal nerves through adjusting the spine. This is getting directly to the cranial nerves that control our sucking reflex. So little babies that are having trouble nursing, babies that are having colic issues, kids that are having bedwetting issues, not sleeping well. And then it even translates into adults that have migraines, jaw issues, and sinus problems. So it's been really an amazing journey.
Fascinating, because you do, when you think of chiropractic, you strictly think about the spine.
Sure.
So is that anything that's done in our country, or is it something that's kind of new?
There are other chiropractors that do it. I'm trying to find other chiropractors that do it in the country because I'm getting messages from different states. I got an email from a mom in Florida that saw a Facebook post of mine through a friend of a friend of a friend, and her 4-year-old doesn't eat any food. So this is more of a problem than people know about. And the first child I saw for it had a feeding tube, and after one visit, they came back and they showed me a video of him eating salad and hard-boiled egg. And he's taking slow progression as opposed to Nick being such a quick turnaround. but it's progress that they weren't making for years. So it's really exciting.
And I think the thing that interests me is, we are kind of a country of here, take a pill and you'll be fine.
Yeah,
and rather than having to go through that, it's finding the solution.
Absolutely.
And that's what you're doing. That's absolutely fascinating.
Yeah, it's
so
exciting.
do you have any other stories of a patient?
One of my patients brought their 17-month-old in. She was having trouble going to the bathroom, which is not something you would necessarily think to take a chiropractor to.
Right.
She wouldn't go for a couple of days, not to be gross, but I did this cranial adjustment on her, and 2 days later, the mom sent me a Facebook post and said she's gone 5 times. She's a totally different baby. She's not crying when she goes because one of the nerves controls the entire gastrointestinal tract. So I'm now currently working with a few adults that are having problems where they eat and they throw up, or they just really strange digestive issues where no one can find anything wrong. And I just say, I don't know if I'm going to be able to help, but we might as well try. It's not going to hurt you.
Right.
So really unlocked a number of different things that I might be able to help.
That's fascinating. Really interesting. And again, it goes back to, sometimes it's the simplest things that can change versus, going through the other route, the Western route.
Our bodies were created to control itself and control itself properly. We don't really live our lives all that well, and we abuse our bodies in many ways. So sometimes it's as simple as getting to the nervous system and making sure the nervous system is working properly. And you can have every test under the planet and they can all come back negative, and sometimes a couple of adjustments will release what needs to be released, and then the body can do what it's meant to do.
Fabulous. Thank you so much, Dr. Suber. We appreciate you being here today.
Thank you.
And we'll be back.